Dr. Val, thank you so much for joining me here on this podcast.
It's great to be here. Yeah. Thank you for having me.
Of course. Yeah, this is actually really cool for me because we actually go way back.
Yes, we do.
When I was on staff here initially in 2017 to 2021, and when I was in grad school, I would come to you multiple times. I actually remember I was freaking out because I didn't think I was going to be able to get licensed in the state of Arkansas because my degree is tailored towards a Missouri, Kansas license. And I remember I went to you one day and you said, there is a path. You will find it and you will get licensed. And I was like,
and look at you now.
And look at me now.
Yeah.
So, but also we worked together at Arissa. In the Paragould Clinic. So tell me a little bit about what you did there.
Well, I went there in 2003, just out of my pre-doc internship, just graduated, just got my doctorate degree. So I did my year postdoc supervision with Dr. Dale Thomas out of Jonesboro, Mid-South. It was Mid-South then.
Yes.
It's Arissa now, after the merger. And so I just did general therapy work. Started out just seeing mainly adults and a few kids, and then me being a licensed clinical psychologist, I do psychological testing. So back then I did a ton of ADHD assessments for our child psychiatrist, Dr. Kahn.
Yes.
And then I would do the occasional adult diagnostic type assessment for personality disorders or something like that. Yeah. So then that just kind of progressed. 2008, I tried private practice for about 4 years and just really felt the call to go back to community mental health. And so I went back, and my second time I did a little bit more testing for law enforcement agencies, for police, pre-employment certification stuff, and then did some other disability determination testing, and did a lot of addiction evaluations for Arkansas State Nursing Board for a little while, and for Department of Children and Family Services. Also did a lot of group therapy.
I didn't realize that you could do therapy.
Oh, yeah.
That's probably like a dumb thing to say. I thought you only did testing as a psychologist, but you can do like counseling. Like
we do psychotherapy. Most of my training in grad school was therapy and psychological assessment. So my kind of main theoretical theoretical orientations are cognitive behavioral and existential. Irvin Yalom is one of my therapy heroes. So in the clinics, I'd mainly do mostly therapy and then do testing. And then when I came here in 2016 to teach full time, I kept a testing practice because I felt I really couldn't give the time that my therapy patients would need. So I went to purely testing.
Okay, so that's why I thought you did testing, because when I went on to Arissa, that's
all I was doing then.
And then when you left, there was no one.
Right.
Nobody in the company doing that. So we lost. It was a big hit when you left Arissa.
And I transitioned to here full-time, kept a part-time practice, but then things kind of changed here where I was more busy and I just didn't really have time.
Totally get it.
To do the practice anymore. I do miss it.
Yeah. Well, tell me a little bit about how you ended up at Williams.
Well, I went to school here from 1994 to 98, so I'm an old guy. And then went straight to graduate school. I was working in the Paragould area. That's where I'm from, and I was working there at the clinic. I was part of the Health Service Corps, which paid back, student loans.
Okay,
it was there
great.
at
that's
Paragould at
awesome.
the time, and so that was great. And it was really a God thing. I'd ran into Dr. Rhodes, who was the chair of the department at the time, here and there at restaurants, at Walmart or wherever. And then one day, we were attending church in Jonesboro, and we walk into the Walmart Supercenter on Parker Road there, and out was walking Ruth Provost, and we had gone to school here together. We hadn't really kept in touch. She went to Wheaton, and I went to school in Springfield, Missouri. So we hadn't really kept in touch, so we talked a little bit, and then 2 days later, I get this call from Dr. Rhodes saying, hey, Ruth said she saw you and we're needing someone to teach some online classes for us. Would you be interested? So I did that. I was already teaching adjunct here and there at other places every now and then when I could. And so that just chance meeting at a Walmart is what got me back on the radar. And then in September, so I did that for one semester, and then 2015, Dr. Rhodes, I was sitting at the clinic at Paragould, Mid-South Clinic in Paragould, and he calls me and says, hey, I need you to adjunct 2 classes for us. And I said, well, I could only do it from 6 to 9 on Monday or Tuesday nights. And he says, okay, that's fine. And I said yes, and then I thought to ask what classes they were, and it was Intro to Counseling and Synthesis.
Okay.
So
cool.
I was telling, and it just so happened he supply preached at our at where we were attending church at the time, and he just mentioned, hey, we think we might be looking to add another psychology professor, and that was it. So I told Debbie 2 or 3 weeks later, I said, Debbie's my wife, said, I'm having so much fun putting these classes together. If they do that new position, I might apply. And she looked at me and said, I was wondering when you were going to decide that.
Oh, wow.
So I texted him and said, hey, if y'all are going to do that, I'm going to apply. And he texted me back, said, well, we're not going to be able to do that. And then 2 hours later, he calls me and says, you're not going to believe this, but 5 minutes after I texted you, Dr. Gary Gregory walked to my office and said he's retiring.
Oh,
And
wow.
so
okay.
Within 2 hours, we're going to open this up, and I applied, and the rest is, it was purely a God thing that I'm here. So
That's
now
awesome.
I'm chair of the department after our department chair was promoted, and
okay,
things are going great.
And look, here you are now.
Yeah, it's wonderful.
I love that.
It's
I love
the best
that.
place to be.
I agree. I have experienced similar kind of full circle feelings multiple times since I've been back, and this is one of them. The start of my career, and now we get to be colleagues again. So
yes.
So tell me a little bit about what you see in today's student body. Just the average student. What do you think they struggle with the most?
I think see a lot of anxiety, a lot of loneliness. Loneliness is an epidemic right now.
Yeah.
A lot of insecurity, and a lot of just not knowing when or how to kind of approach, professors, things like that. But I see a lot of anxiety and worry, and this group, they're young adults, so they're just searching. They're still trying to find who they are.
Absolutely.
And, we kind of expect, you graduated high school, you're 18 now, it's time to be an adult. But really, college is a time for what my daughter, who is in college, says it's a time for adulting light. So they get a taste of what it's like to be an adult, but you still have a lot of support. So I see them kind of still needing that support, and particularly with anxiety and loneliness, those sorts of things.
Yes. And one thing that I think is really special, going back to your statement about this is a great place to be, it really is, because one thing that's really special here is that to professors, it's not just a job. They're here because they're called.
Oh, yeah.
They're here because they care, And when I talk to students who are struggling with feeling nervous about going to their advisor or a specific professor, I'm they will meet you with so much grace. This is not your normal institution.
And, I think leading up to that, they're so anxious about it, the anticipation. But once they get in there a couple of times, they become at ease. They really do.
Absolutely. So So anxiety, like navigating, self-discovery,
Yeah,
adulting.
it's just
Those
kind
are,
of
yeah,
where they're at in their life, and
that's
that's a
normal.
huge transition,
It is.
particularly when your brain's not fully developed yet,
Yeah.
and that's kind of where they are. So
Yeah. So I know before I came on, you were instrumental in helping kind of bridge the gap for a lot of students and providing care, specifically in crisis situations. So a lot of students think counseling is only for crisis moments. How would you respond to that?
I think I understand that viewpoint, but everybody can grow and learn skills to maybe prevent a crisis from happening. I encourage them to view mental health like they do physical health.
Yeah.
Physical health, we have a lot of athletes here, so they eat right, they exercise, and that's going to help them. They're not going to have problems down the road, or less likely to. So if they take care of themselves mentally, their mental health side, then they will also benefit from that for years to come, and maybe have tools in their toolbox to not deal with, to not have a crisis that affects them so bad.
Absolutely.
I tell them, everybody's got things you can work out, and in counseling or therapy. And the best parts of my training, I finished graduate school right at the tail end of when they forced, it was a requirement for all psychologists to go to therapy. And they don't do that anymore. And they used to even require master's level people to do that. It's not done anymore. But that was the best part of my training.
Yeah.
That's where I learned the most about myself, and
I think
how to
it's
do
good
this.
for people in the clinician seat to know what it's like to be in
Absolutely.
the counselee's
Absolutely.
seat. My program actually did require, one specific professor, my group therapy professor, required us to do group therapy, to be a participant in group therapy.
Oh, that's great.
It
We had to do group therapy as well. We had to do individual and group.
Yeah. So I did, the individual wasn't required, but I never had experienced or even really considered group therapy. But then I was like, oh, I love it. This is
One
cool.
of my favorite all-time colleagues, Dr. Ali Hashmi, he teaches at a medical school in Pakistan now, and still does telehealth, sees psychiatric patients in Paragould through telehealth. Wow. But he would always say, you can't hide in a group. And one of my big influences in my therapy work is Irvin Yalom, and he's kind of the group guru. So
Okay, cool. Very cool.
he literally wrote the textbook on it. So
Okay. Well, tell me a little bit about so you have a doctorate in psychology, correct? Tell me about how you see your background in psychology and your professional experience and your education and all of that. How does that bleed over into, your role now as a professor on campus and just everyday interactions with students too?
Okay. Well, I practiced full time in community mental health for 16 years, almost 16 years before I came to teach full time. And so the main populations I worked with in community mental health were people with chronic persistent mental illnesses like schizophrenia and bipolar disorder, personality disorders, and substance abuse.
The severe mental ill.
Severe. And, delusions, all those sorts of things.
Yeah.
So in my classes, I'm able to bring, I've seen everything.
Yeah.
Because I'm old, I've seen everything in the DSM except 3 disorders. And
dissociative identity. Have you seen that?
No, seen that twice.
Oh, wow. Okay.
I haven't seen dissociative fugue, traveling fugue.
Yeah.
Did have a patient try to fake that one time, but did not. It wasn't real.
Sure.
And then I've never seen a couple of the paraphilias.
Okay.
But
wow.
That's it.
So everything
you've seen
it all.
Everything else in Paragould or Southeast Kentucky, where I finished my internship up in the mountains. We've seen everything. So I'm able to bring those stories.
Absolutely. And that's what students want to hear.
Protecting, patient confidentiality, of course. But I'm able to bring those stories into the classroom and, just find examples for everything.
It makes the textbook come to life, though.
And even, when I teach the experimental research design class in statistics, and I can tell them kind of what to look for when they're reading a journal article, and tell them how we would use the scientific method and even some research design skills in the clinic with our patients.
Okay.
So I love that. My style of teaching is more of a storytelling type style, particularly for classes like abnormal psychology, child development.
So when you think about mental health work as it, pertains to counseling or psychotherapy or teaching or a community setting, what gives you the most hope right now?
The students that we are training in this program to go out and treat the folks with chronic persistent mental illness who society wants to forget about, would rather not think about, to treat them the way Christ would. One of our main inspiration scripture passages in the department is the section of Matthew, I think it's 25 or so, where he says, Jesus says, even so, if you have done unto the least of these, so you've done unto me. And that's kind of our command to go do. And it's really hopeful to see some of these great people that are getting their start here and then going to go on and do really great things.
Yeah, absolutely. And provide care to those that society overlooks.
Yeah, the people that society doesn't want to pay attention to. Dr. Rhodes used to refer to people, and I'm sure you've heard him say this, the person with chronic mental illness, severe mental illness, is the modern day leper.
Yeah, that's good. That's good. Well, and I really feel like I experienced that framework when I left Williams, and I know I continued my education outside of Williams, but when I started my professional career, my life first, and this is really genuine, like I have a symbolic thing in my office that I keep now, but my life verse for my work, for my profession, was Isaiah 61, to proclaim freedom to the captives, to help the blind see, bring good news to the poor, to the suffering. So I love that mission is the backdrop of the program. As we are kind of coming to a close today, I just wanted to remind all the students out there listening that if you're feeling overwhelmed, unsure of whether counseling is for you, I want you to know that we are here for you. And even if you're unsure, just take that first step. And the first step is often the hardest, but just take that first step, get in the door and see.
It takes a lot of courage to walk into a counselor's office for the first time. And what I've told students here, what I've told clients at the clinic, patients at the psychiatric hospital when we're referring them out to outpatient counseling, is that, give it 5 sessions and just go in, see your therapist for 5 times, and then you'll probably have enough information to say, hey, this is for me, or no, I think I'm okay, or hey, 5 sessions, I think I'm okay for a little while.
Right.
So that's what I would say to students who are a little unsure.
Yeah, and therapy doesn't have to be a life sentence either. Like, you can go get what you need from it, learn the skills, get in a healthier headspace, and be good. Come back if you need it.
Yeah, most people I would see at the clinic 8 to 12 sessions. And then they may come back in 5 or 6 years, if things have changed, but 8 to 12 sessions was the average.
Well, Dr. Vowell, this was honestly just an honor for me to sit down with you. I'm thankful for your role here on campus, and you make me feel less alone. Like, this is a daunting field.
Yes,
and so
it is.
Yes, having another clinician just right here that I've already staffed cases with you, where I felt in over my head, and you're like, you're okay. You've got this.
Yes, you have got this. And
that encouragement.
That's something that I really enjoy doing as well. So I appreciate you having me on today.
Yeah, this was really cool. So